Fortunately, Utah has not seen the recent spike in cases that other states have. Our numbers have stayed level. Now medical and political leaders are trying to keep it that way.
We're in a plateau right now.
Doctors credit the vaccines for taking us from more than 3,000 cases per day in January to less than 400 a day now.
The cases are down and stable. The test positivity is about what it's been. Hospitalizations are down and stable. We're in a spot where we don't have loads of people in our hospitals. That pressure has been taken off.
Intermountain Healthcare physician Dr. Eddie Stenium says it's a race between vaccines and variants. About 25% of Utah's population is now fully vaccinated.
You know, if we really want to move back to normality, if we want to move back to where we were, pre-March 2020, it's going to take all of us working together to get vaccinated. If we move back to a period where we're all crowding in together, not wearing masks, I think about like gymnasiums, I think about concerts. That's a perfect setting for transmission of this virus. And I worry that if we don't get to that, quote unquote, herd immunity, and we go back to the way we were doing things, we're going to start seeing spikes again.
The current vaccines are effective against the UK and California variants, but the next threat might be forming 7,600 miles away in India, where transmission is rampant.
I mean, it's just tragic. It's awful what's happening in India right now. That is also a breeding ground for variants. When you have that much viral transmission, those are just so many opportunities for that virus to develop a mutation, and that mutation could be, deleterious in the fact that it causes more severe disease, leads to increased transmission, affects our testing, or is able to escape, from the protection that our vaccines provide us.
Dr. Stenium said he hoped the pause would be lifted on the Johnson & Johnson vaccine because he feels the benefits outweigh the small risk of blood clots. He says those are about 1 in a million, and the risk of being struck by lightning is twice that, about 1 in 500,000.